New report on healthcare is estimating costs are going to skyrocket. Healthcare spending in Canada will increase by more than 4% in 2025, projected to reach about $400 billion. CTV's Scott Hurst is standing by with more in our national newsroom. And this report saying health spending is expected to not only exceed Canada's economic growth, but of course, inflation and population increases also driving this.
Todd, rising costs are a reality. As you pointed out, inflationary pressures, one of the key impacts that are boosting, the amount of money that needs to be spent on healthcare, along with a growing and aging population. Those three factors are really the main drivers stretching healthcare budgets, ultimately making it more expensive even just to maintain current levels of care. The new report from the Canadian Institute for Health Information estimates that in 2025, healthcare spending in Canada will grow nearly 2 percentage points faster than the economy, reaching a projected $399 billion. That's a yearly increase of just over 4%. But even though health spending continues to rise, researchers suggest more spending alone will not solve the current challenges facing patients and healthcare providers. Here's more from the Canadian Institute for Health Information.
We're seeing growth in health spending, but a large part of that is going towards the cost of existing care, and it leaves little room for significant investments and change.
So, Todd, ultimately with those budgetary pressures, inflation, the growing and aging population, it is becoming more expensive just to maintain the current level of care. And as the report points out, the current financial environment right now, simply increasing spending is becoming much more difficult.
And where are we seeing this funding going?
Yeah, really, there are three main things that are taking up more than half of the healthcare expenditures in the country. If we can bring up a graph that we have, and it is hospitals that are the biggest chunk, eating away at expenditures at about 26% of total health expenditures in 2025. Then you have physicians taking up about 14% and drug expenditures at about 13%. So as I mentioned, you put just those three categories together, they represent more than 50% of total health spending in Canada.
All right, CTV's Scott Hurst. Good to see you, Scott. Thank you.
Thanks, Todd.